Hey,
Hello.
how's it going?
Good. Am I on mute?
No.
No.
Okay. So I have this up. If you want to test your PowerPoint, we can. If not, I have a backup in case I need to share screen.
It says I cannot start it while you are sharing.
Yeah. Okay. Let's try this real quick. I'm going to stop share, and then we
Okay,
just
there it is.
we're just going to welcome everyone and give some announcements, and then I'll stop sharing screen.
Oh, I can
but
see mine now. Is it not being shared?
I can't see yours.
Okay.
No.
Okay, that's fine. Well, today's presentation is focused on heart health and dental health. Are they related? And just to give you a little bit of background, I am a former dental hygiene educator. So this is a shortened version of lessons I've given to dental hygiene students about what to expect, or the relationship between heart health and dental health. And actually, when I would teach the students, there were a whole lot of other systemic conditions that are related to dental health. But today's focus is just on heart health. But which comes first? That is the tricky part. What the evidence shows is that there is an association between periodontitis and some systemic diseases. But the question is the relationship causative or just associative? And I will tell you now, they do not have evidence of causation going either direction. We are merely talking about associations. And I will also give you my bias that because of the nature of these particular associations, in time, we will have the evidence showing possibly a bidirectional relationship, as they do have for diabetes, which I'll talk about a little bit more later. Right now, what we do see among the list, there are more extensive lists, but these are the main ones, that's showing that periodontitis is associated with cardiovascular disease, diabetes, preterm labor, low birth weight delivery, and pneumonia. And in fact, I'm just going to throw this out here because I won't talk about it later. With hospital-associated pneumonia, they actually do have evidence of causation. This would be why, if any of you have gone to a hospital for any kind of procedures or a hospital stay or anything in the past, I don't know, 10 years, they're always giving you chlorhexidine to rinse. And the reason for this is chlorhexidine is a substance that basically kills bacteria. And they had found that people who were in a hospital and their teeth were not being cared for at all, which, as you can imagine, the nurses had lots of other things going on, and no one thought to take care of the teeth. We come from a history of, here's dental, I guess that my hands don't show in the screen there, and here's medical, and they were not passing or crossing paths. But they found that if the oral health was not being taken care of, people were aspirating the oral bacteria into their lungs, producing pneumonia, bacterial pneumonia. So that one they actually do have more than an association with. The rest of it is still just, they're collecting evidence and cannot say that there is any cause. Currently, what the research does say is that we do have a relationship between severe periodontitis and cardiovascular disease, particularly men under age 50. Who have periodontitis are more likely to get coronary heart disease, in fact, 25% more likely, which is quite a jump. And then we also show the association that 91% of patients with CHD also have moderate to severe periodontitis, which is a 25% jump from those who don't have moderate to severe periodontitis. Now the relationship here that I'm getting to is one of inflammation. That's going to be the primary focus of what I'm talking about today, is the role of inflammation with periodontitis and heart health. But before we get to there, I'm getting ahead of myself. There are some possible pathways for how oral health and oral bacteria, basically is what we're talking about there, can influence systemic health. So the first possible pathway is infection. So of course, the oral cavity is full of bacteria. Some of it's harmless, some of it is pathogenic. And so we have this bacterial soup, I guess, if you want to look at it that way. And it can be introduced into the bloodstream by toothbrushing, by, these kind of things. But we'll get to talk about toothbrushing later, but I'll just throw this out here. That's not a reason to not brush. That's all the more reason to brush. And I'll talk about that more later. Inflammation, of course, is another pathway, because inflammation of your gums is also going to cause inflammation in the entire body. So it's inflammation, whether it's in the mouth or elsewhere in the body. And inflammation is the biggest associative piece to systemic disease. Then there are signs and questions about the immune response, and how when we have gum disease, we're ramping up the immune response, just like we are when we have other inflammatory processes going on in the body. Or most likely what you have is a combination of all these, which is leading to the problems. So the next several slides basically are just going over the pathways or the hypotheses that they have of how there could be a connection between these two. So in this first one, there's the effect of the periodontal pathogens on the platelets. So in this case, the pathogens can come in, whether they invade the walls of the blood vessels or are just present. They can induce clot and blood thrombus formation. Well, of course, when that happens, now we have potential for blocked blood vessels. So that's one potential. The next one is what we call cross-reactivity. So basically, you've got your periodontal pathogens, the bad bacteria, and they are going to create an immune response in the body. And one of those immune responses is to create heat shock proteins. So the periodontal pathogens create their heat shock proteins, and the damaged blood vessel walls create their heat shock proteins. What happens then is your immune system is already going after these things, so they hypothesize that maybe your immune system is going after, that was meant to go after the periodontal pathogens, is now going after the blood vessel walls. So that's what they're calling cross-reactivity. So it's basically attacking the wrong thing because the body gets confused. A next hypothesis is direct invasion of blood vessels by periodontal pathogens. Now this is a fact. They do find periodontal pathogens in damaged blood vessels. What they don't know is, did the periodontal pathogens get there and cause the damage, or were they just opportunistic and were able to invade an already damaged vessel? So time will tell on that one. They don't really know. This one is one of my favorite hypotheses, only because it definitely shows one of the more likely pathways. And that is that when our body starts getting inflamed, it produces cytokines. Now, I once heard somebody describe cytokines in the body as machetes. They just go in and destroy tissue. That's what they do. They're clearing paths for the white blood cells and all that to come in, but they damage. And they're one of the things, for example, with gum disease that cause the damage of the tissue. It is not the bacteria in your mouth that directly causes any damage. It's the immune response to that bacteria. And cytokines is part of that immune response. So basically, the way I used to explain it to my patients was that the immune response is like the body trying to get away from the bacteria. So it breaks down its own tissues that are holding the teeth in. So pretty soon you've got less bone and less gums and less periodontal ligament and all that stuff holding the teeth in. And that's what the cytokines are doing. And they can do that in other areas of the body too. So basically, we've ramped up our level of these machetes in the body to go around and do other damage. Now, the periodontal pathogens also, you will find if somebody has periodontitis, an increased level of C-reactive proteins. So that, as we know, is a marker of inflammation, among other things. And so that's just one of the other pathways here. And then this one, they also suspect that the periodontal infection increases fibrinogen, and the fibrinogen increases fibrin, and the fibrin causes the blood to thicken and clot. So now we've got, you know, another factor for increased heart disease. And then this last one, I'm not a big fan of this one, only because I've been reading a lot of evidence recently about the role of cholesterol in heart disease. And it is my opinion from what I've been reading that cholesterol is also one of those things that's associated with, but not causative of heart disease. But, you know, I'm not the expert on that. That's just, I've read a lot about it and that's what I think. So they don't even know if periodontal infection raises LDLs. And then again, they don't also know if the raised LDLs actually causes heart disease. So, and then this one is actually very likely to be a factor, and that is that systemic inflammation and periodontal inflammation share a common genetic profile. So if somebody is more prone to an excessive inflammatory response, they are going to have more periodontitis, and that is probably true also with CVD. But, you know, it's still just a hypothesis, so we may not know that for certain for a while. So, as I mentioned earlier, inflammation is the key to the damage from both periodontitis and very likely from for these other systemic illnesses like heart disease. Because of all the inflammatory chemicals that are flying around the body now, and because of the elevated CRP, now you've got a higher risk for diabetes, hypertension, cardiovascular disease. And so that's really the key. So when we talk about the relationship between heart health and periodontal health, we're talking about managing inflammation. So this little diagram basically is just showing the differences, because, you know, let's say you get a splinter in your finger. Well, what happens? It goes into an acute inflammation. It gets hot, it gets red, it swells up, it's painful more than you would think for just a little thing. And so you may have loss of function. You're not going to use that particular finger for some things until it starts to heal up. And so that's an acute inflammation. Yes, we start with acute inflammation when it comes to periodontal disease. You start with just gingivitis, which is that, it's an acute inflammation. But if an inflammation is left unchecked, like that splinter doesn't come out, now you may go into chronic inflammation. And this is completely different. And this is what we generally find in people with periodontitis. Yes, you may still see some redness and but you're not going to see pain. Most people with periodontitis, they don't feel a thing. That's one of the reasons why it goes unchecked for so long for so many people, because they can't feel anything. They don't realize that they have a problem, particularly if they also smoke. And I say that because when someone smokes, it causes the blood vessels to decrease in the area. And so they don't have bleeding, they don't have pain, they don't have redness because of lack of blood vessels. But what we will find when we go in and look in their mouth, you've probably been probed, the little instrument that they put in your gums to measure how deep it is. If someone smokes, they may look fine because we are not seeing those signs of acute inflammation. We stick that probe in there and it sinks because the chronic inflammation in there has caused total loss of gum and bone. And, there's a damage going on that's not visible. And that's the case with a lot of this chronic periodontal inflammation. So what we're having with the chronic inflammation is that exaggerated inflammatory response, more immune chemicals, more cytokines, and all that kind of stuff. Now, here's the big question. And this is the one that they want answered in dentistry because they want a reason to be able to treat more people. Does periodontal therapy help to treat cardiovascular disease? So if you have cardiovascular disease and you have periodontitis, if they treat your periodontitis, will your cardiovascular disease stabilize or get better? The answer is they have no evidence of that. And believe me, they've tested it. What they have is evidence of short-term improvement, but not any kind of lasting improvement. So you get a reduction of the systemic inflammation if you treat the periodontitis, and you get an improvement in blood vessel function, but it's not long-term. Therefore, they do not recommend that you get periodontal disease treated for the cardiovascular disease. They recommend that you get the periodontal disease treated for the periodontal disease. And so that's where we are with that right now. So there are a variety of ways that we can control the inflammation in the mouth. Now, if somebody is diagnosed with periodontitis, they do need some professional treatment. There's stuff stuck on the teeth that needs cleaned off. There's the roots need cleaned off. All that can only be done professionally. So the stuff I'm about to talk to you about is what people can do outside of the professional setting that will help to maintain the health that they have or to improve the situation that they have. But if there's tartar stuck on those teeth, especially under the gums, this can't do it all, but this will definitely help. And so this is what I will talk to you about. Now, I want to throw in something about diabetes here, which I think I meant to talk about later, but whatever. I'm going to talk about it now because this is another reason why this is super important. I know that diabetes is not the topic of today, but they have established the relationship between diabetes and oral health. It has what they call a bidirectional relationship, which means if you improve someone's diabetes control, their oral health, their state of their gums will improve. If you improve the state of their gums, their diabetes will improve. So they have established a very direct relationship. And the importance of that is in many things, but one of them is that means that they have now developed protocols to reach out to people with diabetes to make sure that they're getting dental treatment to maintain, as part of maintaining their diabetes. The IHS has established programs to help with that, to pay for more dental treatment for people with diabetes. So eventually we may get there with heart disease, but we are not there now. Okay, back to this, biofilm control. So biofilm is basically just all the bacteria that's living in your mouth. And you may have heard it called plaque, so plaque control, same idea. It's just layers and colonies of bacteria in your mouth. Now, seems to me maybe I should have thrown in a couple slides about biofilm, but I didn't. So I'm just going to explain the way biofilm works. Since we have bacteria in our mouth, there is, you might say, well, why bother? It's going to be there. That is true. However, every day, or I shouldn't say every day, let's just assume you brush your teeth every day. You get that stuff off of your teeth. So the little stuff, so it's all floating around in your mouth. As long as the bacteria floats around in your mouth, it is not going to harm you. It's once it gets attached to the teeth and builds into a biofilm, that's when it can harm you. So you have the little round bacteria that's floating around. It's harmless bacteria. It attaches to your teeth. If you let it stay there, it sends out signals. Okay, next layer, come in. We have room for you here. So the next layer is able to attach to the round ones. So it might be the little rod-shaped ones or the spirochete ones. So now they attach to the round ones. You still don't brush it off. And so now they say, okay, next layer. And it calls for the even worse ones to come and attach. And you've got this biofilm now that's growing. And it puts out toxins. And it does all these things when it's part of a community as a biofilm that it cannot do when it's floating around in your mouth. So a pathogenic bacteria that's only floating in your mouth is not pathogenic. It's not hurting anything. It's only when it joins the biofilm community. So that's what we're going to talk about, how to get rid of that biofilm and keep it from being able to send out the bad messages and the bad toxins that cause the inflammation. So we have two different pathways. We have the chemotherapeutic pathway here. We have the mechanical disruption pathway over here, which of course has lots of branches. So we'll just talk about those both ways. So mechanical disruption basically means you are physically removing the stuff from your teeth. Chemotherapeutic means you're using a chemical to remove it. So I already mentioned about professional care, which is important. It's not an either or here. They go together. So toothbrushing is your first line of defense. And of course, we have a couple of different options on toothbrushing. You have your various electric toothbrushes, and then you just have your regular manual toothbrushes. The electric ones work in, there's two main kinds of those. There's this one I have pictured here. This is a brown Oral-B, and it rotates, has the little round head that spins around. This is my favorite kind. It does an awesome job. The research backs it up that it will do, if somebody has a lot of more of a problem with plaque, then this is an awesome thing for them. It will make a difference. I have seen electric toothbrushes be a huge benefit to people who are plaque factories. That's what we call them in the business. There's the technical term for people who make a lot of plaque. People who don't make a lot of plaque, they can use these if they want to, but you're not going to see the huge difference. I have been blessed to not be a plaque factory. So to this day, I'm probably one of the few hygienists who doesn't use an electric toothbrush. I use a manual brush because it works for me. But if I had a problem with plaque, I'd get the electric. I bought electrics for all my kids just because, well, you know, when they had braces in particular, it's been useful. Now, the second kind of electric is the Sonicare type. You know, it has ultrasonic waves going on. And those are awesome too. I have seen those make a huge difference for people who have a real problem with gum disease. So I do recommend those also. They're a little harder to get used to, that ultrasonic feel and the little screechy whine. You know, those two things I don't like, but that's just me. I know lots of people who love their Sonicare brushes, so I highly recommend those also. So that's your first line. Get the stuff off of there. Now, I also want to emphasize using a soft toothbrush. Your electric ones are always going to be soft, but your manual brushes, they actually still do sell in some places, ones that say medium or hard bristles. Don't buy those. Occasionally, I've come into possession of those for one reason or another, and they're great for scrubbing around your little faucets in the sink in the kitchen, but not on your teeth, because they will wear away the structure of your teeth and your gums. So you want the soft. They'll say soft on the packet, the box that you get the toothbrush in. And there is a legal definition of what they can say. They can't just call themselves soft. They have to meet that legal definition of size of the bristles. Has to be no more than, you know, so many microns or whatever. So it makes a difference, and it will get your teeth clean. A lot of people who we've convinced to switch from that hard brush, they like, oh, my teeth just don't feel clean. So there would be an adjustment if you were coming from that. But believe me, you can have your teeth feel clean with a soft bristle brush. Now, here's one that people don't think of, but if y'all had a mirror here, you could look at your tongue and see what it looks like. Tongues come in all kinds of looks. I've even seen a guy who surgically had it forked. Like, ew. So that was when I was teaching at the college. So of course, everybody wanted to see it, and he was too happy to show it to us all. And of course, lots of piercings. Don't recommend that either. Well, there's nothing wrong with the forking, that you know, health-wise, if that's what you want to do. But tongues can be very coated, so you can have that very thick white look. That's not necessarily unhealthy. I mean, a lot of people, that's just the way it is. But more often, it is, they might have the thick little, well, we call them papillae that are on your tongue, the little velvety things that stick up. And sometimes people's are thicker than others, so it gives it a whiter look. But often, those papillae are holding all kinds of bacteria in there. It's just stuck in your tongue. And in fact, if somebody has a real problem with bad breath, there are two possibilities. And unless it's coming from your lungs, okay? If it's coming from your mouth, there's two possibilities. One, they have a gum infection. Okay, three possibilities. Two, they have a tonsil infection. Or three, they have a whole bunch of bacteria stuck in their tongue. They call those, and they in the tongue, they create what we call volatile sulfur compounds. And those things, sulfur, you know, rotten eggs, gives you a bad smell. So if you wanted to have your easiest way to possibly improve your breath, use a tongue scraper. Now these, they come in various types, but they're all some version of this. And it's, you can get these at the dollar store. I did, came with a tongue cleaner, a harder toothbrush, which I use to clean my sink, and a toothpaste, all for $1. So, and I bought it just to have the tongue cleaner. So you basically just put it on the back of your tongue. You know, you don't want to gag yourself, but as far back as you can manage, and then just scrape down, and you see the white stuff coming down on there. That's basically what it's going to look like. Now, this particular person their tongue was fairly clean in the first place. That's, you know, this is something that needs to be done regularly just to keep that bacteria that's lodged on the surface of your tongue out of there. Now, the other place, so we've cleaned the outsides of our teeth, well, and the, you know, the tongue side, and we've cleaned the tongue, but now we have the between the teeth, or we call interdental, it's called. Excuse me. Ouch. Sorry. Daughter doesn't understand, door closed, don't come in. Okay. Anyway, interdental cleaning can be done in a variety of ways. How many of you have been nagged to floss? I, as a hygienist, never nagged anyone to floss. I figured out okay, I've been a hygienist for like 35 years or something. I have to add it up. Yep, 35 this year. And one of the things my patients always told me, because I know this because they tell me, they like this about me, you don't nag me, because I knew nagging didn't work. So why would I do that? But I'd still want to encourage them to clean between their teeth. So there are a variety of ways to do that. I'm just going to tell you right now, I haven't flossed in years. But that doesn't mean I'm not cleaning between my teeth. I'm doing some of these other things. So they have these interdental brushes, and they have a variety of these. You know, they have this one here. These are kind of a pain because you have to put the little brush in there and lock the little handle. If you have a dexterity issue, those are a pain. But they work fine. They're just, you know, or they have these disposable ones. So they have a little handle with the brush on it, and you just use them to clean in between. Now, if you have perfectly pointy little gums like this guy does not, then these will not work for you because they're too big. So if you want to create a space like that where there isn't one, use these things. So don't use these unless you already have a space. See, this person is clearly a perfect candidate for it because you can see space between his teeth or her teeth. I don't see whiskers, so this might be a woman. I love these things. I do use these sometimes. End tuft brushes. They're little, usually pointy, but not always. Sometimes they look like that. And you can just use the brush. You just kind of put the point between your teeth and wiggle it around a little bit. These you can use if you don't have spaces between your teeth. And they're awesome. They just kind of get the little corners of the teeth and in between. And they're awesome. Then you have toothpicks. These things are little toothpick holders that make it easier to get in the back. Really only useful if somebody's hands are too big to get in the back, which is true. It's, you know, a lot of your bigger men, they're not going to get those hands way in the back. They're not going to be able to do it with floss, and they're not going to be able to do it with a toothpick. So these kind of holders are perfect. For people whose hands are small enough to get in there, you could just use a straight toothpick. And it's not like you're just pushing it between your teeth. You kind of rub it on the corners and go around the gum line with it, you know, and it just kind of cleans things up. If you want something a little softer, I also love to use these. These are called soft picks, and they're basically soft toothpicks. They're plastic, and they have a little bit of fuzzy plastic stuff on the end. And so, yeah, you can use those just like a toothpick, and they're awesome. You can use Stim-u-dents. This is one of those that you also don't really want to use unless you already have spaces between your teeth, or you'll create some. So if you are using Stim-u-dents, I will just point out, use the flat side towards your gums, not the pointy side. I don't know what this black stuff is on here, but I'm guessing it's some kind of tobacco. Maybe this person does chew, because it frequently can look that way on teeth, but I don't know that for certain. And then there's several other awesome options. If you have a lot of gums between your teeth still, but you don't want to use the string floss, these things, I just looked them up. Oops, sorry, I didn't expect it to do that. I just looked up the power flossers this morning on Amazon just to see what the price was, and it's gone up a little bit in the last few years, but $8.50. You get this little thing, and it has these tips that are disposable. You pop those off and put on a new one. You stick it between your teeth, pull the, or press the little button, and it like spins around in between your teeth and does a little flossing thing. And they work great. If you have somebody with braces, perfect. Because nobody likes to use those stupid little threaders that you're supposed to thread it under the wire in the braces. They give those to you at the orthodontist's office, and I don't know why. They should just give them one of these. For $8.50, they can afford it, tack it onto the price of their braces, and give a kid one of these things so they can actually clean between their teeth, because they're not going to thread, I guarantee you. Another option, this came out, I don't know, 6-7 years ago from Sonicare. It's an air flosser. And it says air flosser, but it actually uses air with some water droplets, and it just does like you hit the trigger and it goes psh, and blasts right through between your teeth. It doesn't work as well as flossing. Their own materials say this is for people who won't floss. So they're admitting that floss type things work better, but this is pretty good. So if you like gadgets and you want to try something like that, this is a good option. And then here's my favorite, a water jet. Now this happens to be Waterpik. They're the ones that first came out with water jets. Golly, way back in the 60s or 70s, I don't remember. We had one when I was a young person, and I'm old, so they've been around a long time. But these work better than anything, and there is evidence to back that up. They're basically like a power washer for your teeth, and it'll clean in between your teeth. It will blast that stuff right off of there, and you can use it. See this thin little tip here? You can also use this as a nasal irrigator. So if you're irrigating your sinuses, it fits right up there. I know that idea kind of grosses some people out, but they come with numerous tips if you don't want to use the same tip in your nose and your mouth. But I'm telling you that they are totally connected. So it doesn't matter that much because they're sharing all the bacteria anyway. But these work great. The one I have, because I just don't, I know if I had one of these, I wouldn't use it very much because it'd be a pain. If you want to let it sit on your bathroom counter where it's ready to use every day, great. I'm not a sit stuff on the bathroom counter kind of gal. So I bought on Amazon a version that attaches to my shower head. So every time I take a shower, I just spend a couple of minutes, it has like a little knob to run the water into the hose and blast away with the water jet on my teeth in the shower. So there's that option. We have one that connects to the faucet for the kids to use in their bathroom. So there are various options besides the ones that sit on the countertop, but these are the best. If you were just going to do one thing, you could even probably get away without even brushing your teeth if you used a water jet, because it will get stuff off of there. And it's got, the variable pressure and all that. So you can, get what's comfortable for you. And they have all kinds of videos that'll show you how to use it properly and all that. And then lastly, we have what? Hello? No? Okay. Lastly, we have the chemical stuff. So basically Listerine. Now, you can buy a generic Listerine. It doesn't have to be the name brand, but as long as it has the essential oils, these 4 essential oils in it, and you must have all 4. That's how they do it. That's how they work together. And they will actually help with gum health. They won't do it all, but they will help. So I definitely recommend that. They have some prescription strength things too, but that's, you know, that's on the professional care side. Now, I was asked to address something about dentistry during COVID-19, and I will just basically tell you where we are and where we have been, I guess, for the past year. As you know, the dental clinic shut down for, depending on, you know, where your clinic is, they shut down for 2 to 4 months. And I believe most of them are working now. I haven't talked to Round Valley for a couple of months. I know that they were having to do a bunch of remodeling, so they were slower than some to reopen. But dentistry had to shut down because, and somebody even said this to me once, I don't know why the dentists are having to shut down. Well, I'll tell you why. Because coronavirus is a, you know, respiratory, you're inhaling droplets. Dentistry produces a ton of droplets. So people who work in dentistry were at the highest risk of anyone to contract COVID. And so not only were they, the workers, at risk, but so were the other patients. So therefore, had to shut down, had to figure out precautions to take. They have figured that out. They have put them in place. They have air scrubbers that are, you know, basically filtering the air. They have ultraviolet light things that are, you know, also killing things. They have extra disinfection procedures. They have all those things in place now. They have, so that they've had to see less patients at a time. So because, you know, it used to be where the dentist would pop over to see the hygienist patient, then pop back over to it. They don't do that anymore. They have to just basically keep one thing going at a time. They're wearing N95s usually now. So there's all kinds of precautions that they have taken. But for a while, I don't know that any of them are still seeing emergencies only, but for a while that was it. Even during the COVID shutdown, they were seeing emergency cases. But what we're hoping is if people take the precautions for their own oral health, there will be less emergencies, and the dental offices will be able to get caught up, which is what they're doing now. They're seeing people as they can and trying to get caught up. They are revamping, like Round Valley, who had the open bay clinic. And so now they're enclosing them. That's what the construction was going on there. Most of the other clinics, I haven't seen all the clinics, so I don't know what they all look like, but some of them had to go to just using every other operatory, which cuts down on how many people they can see. But at this point, it is safe to go to the dental office. They maybe have more of a backlog than they did because of having to be shut down and because they've had to slow down their treatments. But that's basically all I have to say about dentistry during COVID. I'm sure somebody might have a question about that, though. That's something I didn't think to mention. So I will turn it back to you people who are managing questions.
Hi, Jan. Thank you for sharing. It's a wealth of information. I learned a lot myself. I have been reviewing the chat box. I don't see any specific questions. There's some compliments and comments in there, but if people have any specific questions they'd like to share and have Jan respond to, and now would be a good time.
Yes, I have a question.
Okay.
I use a lot of essential oils, and I was wondering if there's any in particular that you could suggest that you think would help improve with like inflammation within the mouth and stuff like that and everything. Because I have I have been diagnosed with like inflammation throughout my body, and they can never say what would cause it or anything. I brush my teeth 3 to 4 times a day. I floss, I gargle, I do all that. So I'm like, now I'm thinking, is this part of what is causing it, whatever? And is there some any kind of essential oils that you could suggest that would help fight off that inflammation and stuff?
The main ones that the research supports are the ones that are in those 4 that are in Listerine. Those are the main ones. I mean, there's various other products, but I have not seen consistent evidence of them, so I don't want to promote them.
Okay, thank you.
Sure.
Jan, just really quick, I'd like to request that people fill out the evaluation form. It's listed in the link provided in the chat. That helps us to see how the session went, see if you guys have any feedback for us that would be helpful for our planning for next webinars and trainings. So your input is really valuable. There is a question from Janice Mendez. It says, I know people smoke marijuana all the time. Does the inflammation issue you mentioned about cigarettes smoking apply to them?
Generally, yes, except for some of the effects from smoking are from the nicotine. So you're not getting that, but you are getting the effects from heat and from the changing. A lot of the effects from smoking are because you change the environment in the mouth. So you've changed the whole chemistry. And so therefore you have changed the bacteria that thrives in that environment. And so you still have that also with smoking cannabis. You've created the heat and you've changed the environment. People who smoke anything tend to have drier mouths, which also changes the environment. So what they have found is in people who smoke anything, you have a higher proportion of pathogenic bacteria in their mouth. And so there is that standpoint. What you don't have, the nicotine causes loss of vascularity in the gum tissues. So since you don't have nicotine, that is not as severe. But there are some other effects. And I did do a presentation at one time about the effects of cannabis on the mouth. And so not as severe as cigarettes, but almost.
Okay, any other questions?
Yeah, I have one as it relates to heart disease and stroke. I know that sometimes if you have been diagnosed with any one of these issues, it's a little bit more difficult to get an appointment during these times. And just for the sake of our webinar, I wanted to ask if you can cover why it might be a little bit more difficult for people to be getting appointments during this time with heart disease and stroke as a comorbidity.
You mean why it's difficult to get a dental appointment? Is that what you mean? Okay, 2 reasons. One, many, if not most of the dental clinics already had a waiting list. So then you add 2 to 3 months shutdown on top of that. Their waiting list got longer. So they're still working on clearing that backlog that they made worse during that time. And the second reason is that they've had to reduce the number of operatories operating at one time. So, you know, they just can't serve as many people at the same time as they used to at this point. So yeah, those are 2 big reasons why they're not able to get in as frequently maybe as they were before. And I know the dental clinics are doing their best to clear that up the best they can, but there's only so much they can do with the restrictions that they have on what they have to use.
Thank you, Jan.
Awesome, thank you. I'm not sure if this was covered already, but Pam Manning did mention that the black spots on the gentleman or woman's teeth from earlier, those look like silver diamine fluoride, which is added to the teeth to stop decay.
Well, the reason I didn't think it might be that, I guess it could be if there was very small decay, because yes, the SDF does have that kind of a look, but there was no holes. There was no like divoting in the teeth where there would have been decay. So if they put that on there when there was just a very slight decay, then I guess that could have been it. But usually you see a bit of a hole in the tooth that is now black from the SDF.
Okay, one last offering for questions to be answered by Jan, and then we'll wrap it up.
Just one thing, and I messaged Ephraim, but when you go into the Survey Monkey, it's wanting us to create a survey instead of having the survey to do. It says log on and create your own survey. Do you know why it would do that?
I'm testing it right now. 1 second.
And just a reminder, if your survey doesn't work, looks like in the chat for some people it is working. The survey link will be in the follow-up email as well. But if you have a chance to do it today, please do it today so that you don't have to circle back.
Okay, thank you.
Thanks.
I am clicking on it and it should look like this. And I clicked on the link in the chat. So you would put your name, wherever you're from, UIHS, or if it's a clinic or a tribe, whichever one, put your date and you answer really quick questions, you hit done. I can try and put this direct link in here too.
Thank you, Ephraim. So we'd like to thank Jan for taking the time to prepare her session for us and also for sharing and answering questions. I think it's really helpful, especially right now, to provide people with a reminder about dental health and heart health and have some understanding of the things we can do at home to help take care of ourselves and also the resources available. If anybody has specific questions about dental health, I'm sure that Jan would be available to answer questions. You can email your questions or inquiries to me or Ephraim or Julie on the ACORNS team, and we can pass them on to her. And then also the recording will be shared with you by email, probably in the next day or two. So thank you all for your time and for joining us today. Have a great day.